Thank you for joining us. We're very excited to be able to share some information with you about oral health for your children. We're the team of doctors from Growing Smiles. I'm Dr. Diana. We have Dr. Amber, Dr. Lyman, and Dr. Chris. And we'd like to take a few minutes to address some of the questions that have been given to us, things that parents want to know. As we know, during a dental appointment, we have a lot of information to cover, and sometimes the parents may not think to ask these questions. So here's a chance for us to try to give you some more information. First question we have is, what is an appointment like for a 1 to 2 year old? Should I even bring them if they only have a couple of teeth? Dr. Amber?
Good question.
So this is where we help establish the dental home and hope to help their child remain cavity free. This is where we also talk about whether the fluoride needs, proper brushing and flossing techniques, and much more.
Excellent. One of the things that I find most beneficial for that first visit is we're of course treating their mouth, and we're trying to help them stay healthy, but also we're treating the psychology. We're trying to help this little patient, your son or daughter, become more comfortable laying down, and with the noises and the bumps and the different things that are happening, people having their hands in their mouths, all of those different things that are happening, so that then in the event that something happens later, we already have a relationship established. If we need to fill a little sugar bug or they fall and chip a tooth, it's an easy fix because we've been seeing them for an extended period of time and they're not scared. And that's one of our main goals, is to try to help keep your child, our patient, our friend, comfortable as soon as we can.
And then also from a health standpoint, up until the point before they have a tooth, they have tissues in their mouth, the skin in their mouth, the gums in their mouth that can shed, so they're only there for a temporary period of time. Whereas when they have teeth that are erupted, now bacteria that lives in our mouth, the sugar bugs that we're after, they have a place where they can live for years and years and years. So as soon as a tooth is erupted and a bacteria has a place to live, that's when we have to jump in. And we have to talk about how we can prevent those bacteria from having extra colonies on those teeth, to keep them clean and to not feed them so that we're not making cavities.
Although we've known for quite some time that children should have their first visit by their first birthday, a lot of pediatricians are still hesitant to recommend that, and we want to just get that information out there that in addition to establishing the dental home, we want to start them off on the right foot. That brings us kind of to the next question, which is, how do we prepare for that first visit? I'm going to send this to Dr. Lyman because he actually has a video on our prior Facebook post that kind of gives us some guidelines on that.
Yeah. So again, that first visit, there are going to be a lot of questions, and we want you to come, as Dr. Amber said, we want you to come and feel comfortable asking those questions and to be prepared. But essentially what we're going to do is we're going to help position the child in such a way that they will be looking at you, seeing you, and they're going to lay back into your lap, and we'll be sitting across from you, so they lay down in what we call a knee-to-knee position, and it allows them to see you the whole time, and we can get a good exam done, we can get a good thorough cleaning done, we can show you tips and tricks on how to brush and floss, because sometimes that can be battle royale, at least at my house sometimes, and help give you some ideas there. They might do their American Idol audition for us, and if they do, that's okay. We're prepared for that. It gives us a great view of the teeth, and the kids will recover and very quickly establish that this is a safe place and I'm okay and safe here.
Dr. Chris?
So on rare occasions, we do have the 1 year old or the 2 year old that's going to be the life of the party for the rest of their lives, and they're chatting it up with the staff and with the assistants and with us. But most frequently we have the kid that's very apprehensive, that's nervous to come in for the first time. And honestly, at a kid that age, we'd prefer them to have the stranger danger, just because they're in an unfamiliar place, they're seeing unfamiliar faces, and we're not just looking at them and saying hi, we're actually getting in there, we're cleaning their teeth, we're taking a good look at their teeth, looking under their tongue, things like this. So it's a very personal, intimate space that we're asking to enter. So it's perfectly normal behavior, especially at that age, to be a little apprehensive, a little bit scared. So a lot of anxiety comes from parents thinking, well, my kid's not going to be able to sit for you guys, they're going to cry, whereas really that's just normal behavior for their age.
For sure.
I find that it's just as important to prepare the parent for the visit as it is the child. And I just like to reassure parents that they need to be confident in the fact that they're bringing their child in to show them that they need to take care of their oral health as much as, because that's part of their overall health. And I know Dr. Amber has similar thoughts with that. Anything you'd like to add?
I was just going to say the same thing. Usually parents come in just as anxious as their child does, and that's okay. That's normal, and it's perfectly okay for them to ask as many questions as they want or that they need to.
So as part of asking questions, one of the things that we do frequently get asked about is the use of fluoride. There's a lot of confusing information out there, and Dr. Chris has a great explanation on the role of fluoride and why it's important with our kids.
So the way I like to explain it is the teeth that we already have that are in our mouths, as opposed to the ones that are developing, they are all the time when we're eating, they are going through a constant state of breaking down slightly and then rebuilding themselves. And when we have fluoride around, those teeth are just crying out for that fluoride to uptake the fluoride, and it actually makes them into a stronger version of themselves where they're more resistant to cavities. So anytime we can get fluoride on board, and of course that'll depend on your kid's age, how much we want them to have and when we want them to have it. But anytime we can get them that fluoride, because their teeth are really crying out for it, so they can uptake it, make themselves stronger, and then we can be cavity free.
One of the concerns that parents often have is, is my child going to swallow this toothpaste? And that's why we control the amount. We just want that tiny little smear on there. But we expect that they probably are going to swallow a little bit. And in a controlled amount, that's actually a helpful thing because that fluoride will get incorporated into the developing adult teeth and help to make them stronger as well. That's along the same lines of why we want children to have tap water, because we want them to have the fluoride in the water. We want a little bit of fluoride ingested on a daily basis. Dr. Amber?
Yeah, so I usually demonstrate to parents the proper amount of toothpaste to use on their toothbrush. I usually tell them it's about the same size as the child's pinky nail, and it's just a tiny little smear on the toothbrush for kids under the age of 1. And then at 2, we usually bump it up to about a pea size. And I usually tell them, don't let the child put the toothpaste on the toothbrush by themselves. Always have an adult do it.
Yeah, one of the points that Dr. Amber makes as well is that we're using that fluoridated toothpaste from day one. As far as soon as you see that tooth coming through the gums, we start to use it. We know that you'll go to the store and there will be toddler and training toothpaste and things, and those don't really have a big place because oftentimes they don't have fluoride in them. And so we want our children, our own children, we've used fluoridated toothpaste for them, and that's what we recommend for our patients as well.
We hope that you've learned some information with us. We love to share and educate our parents and our patients. Tonight we focused on the younger, the infant and the toddler. There's lots of information that can still be learned for older children, so stay tuned. We'll be back.
Thank you.
One of the other questions that comes up frequently is about the use of fluoride toothpaste. There's a lot of confusing information out there. I like Dr. Chris's explanation as to why fluoride is important, if you would share that with us.
So for the teeth that we already have that are in our mouth. You're going so good. I saw it every time.
I know. I watched it.
I would see it.
I watched it.
We can just cut that out, right?
Yeah,
We'll
we'll put a YouTube version of the uncut.
I think that's the one we put on.
Yeah.
Oh, that is hilarious.